Hi doctors, welcome to the new episode of our A to Z series where in each episode alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE, and our today's episode is episode X where X stands for Xeroderma pigmentosum. So let's begin our question with solving a previous year question. The girl seen in the image has had history of severe sunburns after just a few minutes in the sun, severe freckling in the sun exposed areas. The most likely diagnosis is option A, Bloom syndrome, option B, xeroderma pigmentosum, option C, warts, or option D, systemic lupus. So which option do you think is the correct one? Well, yes, option B, xeroderma pigmentosum is the correct option. Xeroderma pigmentosa is a hereditary disorder characterized by a defective DNA repair mechanism, resulting in extreme sensitivity to sunlight and an increased risk of skin cancer. Xeroderma pigmentosa is a rare genetic disorder characterized by extreme sensitivity to ultraviolet radiation, leading to severe sunburn and an increased risk of skin cancer. It is caused by mutations in genes involved in the nucleotide excision repair pathway, impairing the ability of cells to repair UV-induced DNA damage. Now let's discuss the etiology. The primary cause of xeroderma pigmentosa is genetic mutations in gene associated with the nucleotide excision repair pathway. These mutations impair the repair of UV-induced DNA damage, leading to the accumulation of DNA abnormalities and an increased risk of skin cancer. Now let's discuss the clinical features. First, photosensitivity. Individuals with xeroderma pigmentosum experience severe sunburns and skin damage, even with minimal sun exposure. This photosensitivity often begins in childhood. Second, freckling and hyperpigmentation. Dark spots or freckles appear in sun-exposed areas of the skin, such as the face, neck, and hands. Third, dry and rough skin. The skin may become dry, rough, and easily irritated. Fourth, skin lesions. Xeroderma pigmentosa patients may develop various skin abnormalities including nodules, plaques, and scaling patches. Fifth, eye involvement. Ocular manifestations can occur, such as photophobia, conjunctivitis, and eye tumors. And sixth, neurological complications. Some individuals with xeroderma pigmentosum may experience neurological problems including development delays, intellectual disabilities, and progressive neurological degeneration. Diagnosing xeroderma pigmentosa involves a combination of clinical evaluation, family history assessment, and laboratory tests, including DNA repair test and genetic analysis. Skin biopsies and eye examinations may also be performed to evaluate the extent of tissue damage. Now let's talk about the treatment. There is no cure for xeroderma pigmentosa. The management of this condition focuses on preventing skin damage, detecting and treating skin cancers at an early stage, and providing supportive care. The following measures are typically recommended. First, skin protection. Strict avoidance of sunlight, especially during peak hours, and the use of protective clothing, sunglasses, and broad spectrum sunscreen with a high sun protection factor. Second, regular skin examination. Routine dermatological examinations to monitor for any changes or abnormalities in the skin. Third, skin lesion treatment. Prompt treatment of the skin lesions including precancerous lesions and skin cancers, using techniques such as surgery, cryotherapy, or topical chemotherapy. And fourth, genetic counseling, offering genetic counseling and testing for affected individuals and their families to assess the risk of inheritance and provide guidance on family planning. So that's all for today. Thanks for watching and see you in the next episode, which will be episode Y.